Hey there. Welcome back to the channel, and this is another episode of our series called Breaking Down COVID-19 Vaccine Myths. The goal of this series is to look at commonly held beliefs about COVID-19 vaccines and determine whether those beliefs are grounded in fact or fiction. If you'd like to see more episodes, please subscribe so that you can get notified when new videos are released. Today, we're going to be looking at 3 statements about COVID-19 vaccines and determining whether they're fact or fiction. The first statement is, quote, "I'm not at risk for severe COVID-19, so I don't need to get vaccinated." In the United States, the Centers for Disease Control and Prevention, or CDC, estimates that as of February 2024, over 18 million people have had a hospital-associated stay due to COVID-19 since the start of the pandemic. That same month, over 60,000 people were hospitalized with COVID-19 in the U.S., and approximately 10 people died each day from COVID-19. The CDC also estimates that since the start of the pandemic, nearly 330,000 pregnant women have been hospitalized with COVID-19-related illnesses, and almost 20,000 babies have been stillborn or miscarried after a pregnant person was infected with COVID-19. Additionally, researchers estimate that hundreds of thousands of children have experienced the death of a parent or guardian due to COVID-19. While it is true that some people may have a lower risk of severe COVID-19, no one is completely out of the woods. People who have certain medical conditions such as diabetes, chronic kidney disease, heart disease, and obesity are at higher risk for severe illness from COVID-19. However, even people who do not have these medical conditions have been known to become severely ill from COVID-19. Overall, unvaccinated people are 5 times more likely to end up in the hospital altogether compared to those who are up to date on their vaccinations. And while most people who contract COVID-19 will not experience severe symptoms, it's impossible to know how any individual case will play out. Therefore, we rate this statement as fiction, because although some groups of people may be at lower risk for severe COVID-19, no one is at zero risk. Everyone should take steps to protect themselves and others from severe illness by getting vaccinated and boosted according to recommendations from the CDC. To learn more about who is at risk for severe COVID-19, visit the CDC's website. We'll put a link to that in the description below. Now let's move on to our next statement. The second statement is, quote, "I've had COVID-19 before, so I'm good." The idea that having had a previous infection provides immunity to future infections is a common misconception that has been around for many years. This concept sometimes is referred to as natural immunity. But when it comes to COVID-19, the evidence does not support this belief. In fact, studies have shown that people who have recovered from COVID-19 can still get sick again, sometimes even with the same variant they had previously. Additionally, studies have shown that natural immunity from previous infections wanes much faster than immunity acquired through vaccination. This means that the protection you get from being vaccinated lasts longer than the protection you get from recovering from an infection. The waning of immunity after infection can leave people vulnerable to infection with the same variant they had previously, as well as other variants. It's important to note that some people may have some level of protection against severe illness and death, even if they are reinfected. However, this protection is not guaranteed and could potentially disappear over time. Therefore, we rate this statement as fiction because people can and do get reinfected with COVID-19 and may be at increased risk for severe illness and death if they are not vaccinated. For more information on reinfection with COVID-19, visit the World Health Organization's website. We'll put a link to that in the description below. Now let's move on to our third and final statement. The third statement is, quote, "The COVID-19 vaccines were rushed and are not safe." This statement reflects a common concern about the safety of the COVID-19 vaccines due to their rapid development. However, this concern is unfounded. In fact, the COVID-19 vaccines went through the same rigorous testing and approval processes as all other vaccines. They did not receive special treatment. The COVID-19 vaccines were developed using new technology called messenger RNA, or mRNA. This type of vaccine has been studied for decades and has been proven to be safe and effective for other diseases in animals. While mRNA vaccines have not been used in humans prior to the COVID-19 pandemic, the platform has been extensively tested in clinical trials for diseases such as influenza, Zika virus, rabies, and others. Once the COVID-19 vaccines began to be developed, clinical trials were conducted with tens of thousands of participants to evaluate their safety and effectiveness. These clinical trials followed the same guidelines and protocols as other vaccine clinical trials. Additionally, the COVID-19 vaccines underwent the same approval process as other vaccines. In the United States, the Food and Drug Administration, or FDA, uses a two-step approval process for vaccines. First, the FDA requires companies to submit an emergency use authorization request, or EUA, for a vaccine. This step is meant to make vaccines available during public health emergencies, when there is a serious and imminent threat to public health, and there is no adequate, safe, and effective alternative. Once a vaccine is authorized for emergency use, the FDA then requires companies to conduct post-authorization studies to confirm the vaccine's benefits, effectiveness, and any potential risks. The COVID-19 vaccines have been continuously monitored for safety and effectiveness through these post-authorization studies as well as through ongoing surveillance systems. These systems continue to show that the COVID-19 vaccines are safe and effective. In fact, the CDC has stated that the benefits of getting vaccinated against COVID-19 far outweigh any potential risks. Additionally, the European Medicines Agency and the World Health Organization have both concluded that the COVID-19 vaccines are safe and effective. Therefore, we rate this statement as fiction because the COVID-19 vaccines were not rushed and have undergone the same rigorous testing and approval processes as all other vaccines. To learn more about the safety of the COVID-19 vaccines, visit the FDA's website. We'll put a link to that in the description below. Thank you for watching this episode of our series, Breaking Down COVID-19 Vaccine Myths. Our goal is to help people understand and make informed decisions about COVID-19 vaccines. We hope this video has been informative. If you have any questions or comments, please leave them below. We encourage open discussion and respectful dialogue. If you'd like to see more episodes of this series, please subscribe so that you can get notified when new videos are released. You can also check out our other videos about COVID-19 vaccines. Thanks for watching. Take care and remember to get vaccinated and boosted according to recommendations from the CDC.